So thank you so much. And I can like send it to you if you want afterwards, but I don't think we're going to talk about anything confidential. Um, but Sam, if you could just start by just telling us about your background, like what you're currently doing in your role, and would love to hear like what brought you to this work specifically.
Sure, sure. I don't know. There's a lot of things that brought me to this work. I grew up in Seattle, and there's just, this West Coast homelessness is pretty serious. But I was a leftist, and I was working in labor unions, and looking to create social change that way. And I had read a book called The Activist Handbook, and it was about a bunch of different kind of campaigns and activism. It was written by a guy named Randy Shaw, who worked in the Tenderloin. And when I was looking to make a change from union organizing, housing is such a critical issue. So I saw that there was a job in the Tenderloin Housing Clinic being a tenant organizer. And I took that job and brought my kind of labor and kind of power analysis stuff into tenant organizing in residential hotels. And I just remember there's like a longtime tenant activist who's like a 6'4" trans woman and named Antoinetta Stadelman III, and she declared herself a monarchist, and she was just breaking down to me like what goes on in residential hotels, and I was like, man, I'm really in over my head here. But she was amazing, an amazing mentor. And then the people really brought me in and showed me the ropes. And that got me into this world of like housing and homelessness. I started an organization that's still there called the Central City SRO Collaborative with tenant activists. And we had a lot of fun with that for a long time, number of years, 6 years I was doing that. And then I moved to New York City. I was running the New York City's street homelessness response, working on the government side of things. And so oversaw Manhattan, Bronx, and then Brooklyn, Queens, and Staten Island at different times. And we had a 60% reduction in street homelessness and learned a lot. It was many millions of dollars of contracts and outreach teams and different programs, and kind of got my graduate degree at Columbia University while I was doing that, nights and weekends. And we had just performance contracts, which is pretty interesting. You may get into that stuff in your program and planning stuff. And then I came back to San Francisco. They were having so much trouble coming out of the recession, and just large encampments, and didn't really know what to do. And so I was working for Public Works, and I was helping them with their staff. And I started a program called the Pit Stop program, which is a public toilet, monitored toilet program, working with former lifers and other people as like a start for urban maintenance. And so that was great, wonderful experience. And then just also getting to understand Public Works was great. And then, but I was pretty quickly asked to move over to the mayor's office, and because they getting some $3 million to do something about street homelessness. And so I brought this sort of model that we'd had in New York and to San Francisco, the navigation centers, what we end up calling it. And then I was the mayor's point person on homelessness for a while. I started a homeless department, the HSH, and ran that for a long time, and recruited leaders. And recently I was just running it again for a little while and recruited some new leaders and helped them get started. Shireen McSpadden's now the new director there, and she's great. But then now I'm working for the Department of Emergency Management on a project we started a few years ago called the Healthy Streets Operations Center. It's kind of a fancy way of talking about interdepartmental work. And so work with, 15 or more different departments, but a real core of 6 departments when they're responding to street homelessness, and just to try to do as much as we can to sort of make sure that people are taking responsibility for their work, but that they're not, violating people's rights, and that we're, taking a client-centered approach, and we're, doing what works, which is, helping to place people into the programs that can help them change their lives. So, anyways, that's what I'm doing now, and that's a lot of operations now.
Well, it seems like you've been involved with a lot and have been working in like many different locations. You mentioned Seattle and New York. What do you think is unique about the San Francisco population? Like, have you had to tailored your services, or I know you mentioned that you've brought over some similar programs and organizations of some of the work that you've done in New York, but what would you say is super unique for San Francisco?
Well, okay, I mean, there's just a lot that's unique about San Francisco, but it's an ununique problem. We have unaffordable housing and people in poverty that the markets doesn't have anything at all for them. And we have a insufficient social safety net. So there's no handoff, there's huge gaps between systems. And there's every incentive for every system to dump into those gaps, which sometimes is articulated as homelessness, other times it's articulated as drug users, or travelers or drifters, or criminals, or people have different names for it, but it's kind of the same thing, where there's just been this huge abandonment and gaps. And so San Francisco, so New York City is kind of interesting because there's through a series of lawsuits, they established a right to shelter for all populations. It started with a right for single men, and then expanded to women, and then families. And so you have a right to shelter. It's a little different in San Francisco and California and the West Coast in general. There's not enough shelter or anything. So San Francisco, they say there's 8 to 10,000 people any night that's has no shelter, and we have somewhere around 3,000 shelter spaces for people. And so essentially we could say that we are planning to have 7,000 people somewhere on the street. And we have the nation's highest per capita permanent supportive housing, so sort of this kind of affordable housing with social services on site. And so we have over 9,000 units of that, closing in on 10,000, get through with some hotel purchases with home key monies, the state program. So that's, I think it does kind of make it a sort of unique situation, because a lot of places like colleagues in San Jose and other places, they're like, well, we really need to build low income, extremely low income housing. We need a lot of PSH, and let's not bother with shelter. We'll just push ahead and go straight to housing, because housing's the answer to homelessness, and it's a tautology and all this stuff. But the truth is that we're on the other side of that. There is get to where we are as far as affordable housing. And it's look around. This is not working. It's not possibly to scale. And then also, we're not an island, right? If you're desperate for affordable housing and you're living in Marin or, Alameda or Solano County or whatever, what does it mean to ride a BART or, to come into the city? And then what are we going to do, really? Beat someone with a stick until they leave to their county? No, we're gonna, so it's not really solved until it's solved for everyone, and especially within, the Bay Area. So I think that that's a pretty unique situation, in that San Francisco is a city and a county, which is cool. It's fun, in many ways. New York is a city with multiple counties, but there's not a lot of that, and a lot of the welfare and healthcare is in the county budget and in the United States. So mayors are usually pretty impotent, especially if you look at Oakland or something. They've got a city manager, everything's in the county, And so you got Libby Shaft out there trying to make things happen, but she doesn't have the tools, she doesn't have the money, it's pretty unfair. So you get sort of tough sheds under the freeway, right? So um, I think it's a little bit different for San Francisco, as we're a city and a county, so we can draw together some more resources. Still, it's pretty insufficient.
Mhm. Yeah, I actually didn't even think about that, how San Francisco is a city and a county. And I live in Oakland, so I'm super familiar with the things that Libby Shaft is working on. And I do see the tough sheds and stuff too, and have always just wondered like if those are working and how it is like benefiting the community. Yeah.
Yeah, so we all stay in touch just for our sanity, and that's also my old kind of organizer roots. Like I like to get together with the people that are trying to do things in their different spaces. We had something called the West Coast Alliance of Mayors that I did under Mayor Lee, where we got all together these West Coast mayors to try to push for state funding and for federal budget changes. And then we also connected to Vancouver, BC, so we could share some there too. Sort of internationally, what culturally is happening on the streets is kind of exacerbating things too. There's just level of despair with people in the changing economies and the leading to drugs, and what we can do, what they have done is sort of an inspiration for us just to save people's lives and have drug user health go towards a prescribed drugs instead of street drugs to kind of combat the adulteration. But we can always get together and find more. So the Oakland guys stay in touch, and it was going pretty well. I think with the tough sheds, they had 2 for a shed, which is kind of interesting, but it helped to provide some density to those relatively small programs. They have a sort of a narrow path to get everyone through in Oakland. And it really relies on a downtown shelter, the Henry Robbins Center. That's really their only well-staffed and seasoned kind of program in the city that's had pretty high success rates in getting people into housing. But that's just because there's just not a lot of diversity. There's not a lot of different places for people to be. But I think it's been super helpful. I mean, just the sanitary, conditions and safety and ability for people to sort of step a little bit off of the fight and flight instincts that dominate living out on the street unsheltered, help a lot of people. And they have so many, it's hard because the inflow is not created by the system, right? So it's just there for the water.
Yeah, no, totally. And you mentioned a little bit earlier about like some of the gaps in San Francisco in terms of like services for this population. What would you say are like the top 3 major gaps in services?
Well, I mean, it's certainly mental health and behavioral health is like a huge gap. And so they would like to dump into sort of a homeless system. And that's not a good setting for someone who's, fragile in that sort of state. And if they can't sort of tolerate congregate settings and sharing and sort of some close quarters, like if you think about a lot of our, affordable housings and residential hotels or, studio apartments and stuff, if you can't be a good neighbor, it's going to make a lot of people's lives pretty difficult who are extremely low income, have traumatic pasts and histories and are doing the hard work of sort of turning everything around. And that's not very fair. And the healthcare system and the jail kind of that whole system, there's just discharge, and there's a lot of like, well, I don't have anywhere to bring you, but here are your shoes and stuff, and I don't know what you're gonna do, but the doctor says not to go, but we can't stop you if you just walk out, right? And then people just walk out. right? Because they get the message. And so then, we have people kind of rotating through, the psych emergency and the street and, becoming victims to other people's kind of schemes with drugs and, abuse. So yeah, I mean, I worked here for a long time. I've rarely worked with a woman on the street who hasn't experienced some sort of violence. And so the scale of what we're really looking at is really quite tragic. And so I think that in many ways, like, I would love for everyone to be housed. And I think that's a very important goal. And that I think we can do that. If we put our minds to it, of course, we can do that. But really today, we can't have people just having to know where to be and having to sleep rough on the street or in a tent. All that stuff is extremely dangerous. And, nothing we would want anyone we cared about to have to face, not for one night. And so I think like that's a major gap.
Yeah, I think our team is focused on mental and behavioral health for this population. We've also talked about substance use, but is there anything that you would say like some agencies are currently working on to support like mental health specifically?
Sure. I mean, there's when we were doing the navigation center, we had the Hummingbird kind of was a sort of a DPH navigation center, which was a little bit of a replacement of a low threshold drop-in center that was on the campus of SF General. It's kind of on the very northern side of the General campus. And so there's a couple of those right now. And it's a nice model, but now they have some overnight beds, some emergency shelter beds, which I think is really important. It's just basically a place that someone can be brought if they are, like that. And then the system needs a little bit of time to find a bed or to figure out the solution. So sort of an interim place. I saw in the chat something about the safe injection sites.
Yeah. So Humera is, she's at work right now, so she's listening in, but she had a question about what your thoughts are about the safe injection sites that some programs have implemented to combat substance use in homeless populations.
Yeah, it's really for everyone. And but it's especially nice for people that are experiencing homelessness. One of the things we did when we were surveying street homeless injection drug users is ask what they would like in a safe injection site. And you'd be surprised, the number one, maybe not, but the number one thing that came up was a shower. People, it can feel nice to get high and take a shower, but it's like part of this, like putting yourself together and getting unsick, which is where a lot of our opioid users are at in their substance use, and kind of put back together. And so yeah, I've definitely spent a lot of time in Vancouver with my colleagues up there, the Portland Hotel Society, and they have a lot of innovative models. They brought safe injection into supportive housing, standalone safe injection. The Insight facility is pretty impressive, but more impressive are these overdose prevention sites that are peer run. They get higher volume usage and have outdoor smoking and indoor injection. A lot of volunteer help there to both like safeguard people, maintain the sort of space as a dealing free space. But then, there was all kinds of things happening there. Big marijuana activists, like helping people take CBD to kind of combat the withdrawal symptoms. They were all kinds of interesting stuff. I didn't say this, but I spent not last year, the year before, in Norway, and was working with groups around in Europe and in Oslo. And in Oslo, they had a safe injection site. It's a very anti-drug country, extremely, but they decriminalized drugs, and they had a safe injection and safe, smoking site with emergency beds there as a way to sort of work with people who are chaotic substance abuse and found themselves homeless and using, as a way to kind of bring people back into the fold. So I think we can do a lot. Yeah, I don't know if you know the Drug Users Union in the 10, Missy, yeah, M is there. Yeah, look at their, they have a good Instagram, the Drug Users Union, and it's essentially a private club that is a safe injection, safe consumption site, and they receive some support from the city, but they are largely operate on their own. And then it's not sort of open to everyone, but they get, pretty down and out users working there and using it there. And so that's been a pretty good inspiration. Everywhere that they've done this, they first do it before the government, like activists do it, people do it. Here in San Francisco, we do, one of the unique things about it is that people were very conditioned to being paid to do this work. Helping people and stuff is seen as a job instead of like something we might do because we care for each other. So I think that's a really weird state we're in that all these years, all this planning, all these people, no one can just do it. So it's very frustrating.
Well, you're doing a lot of very amazing work. So yeah.
The opioid crisis does weigh heavily on us all. So, we used to really pilloried around, poop and syringes. And so we did a lot of work on this, the pit stop program, the monitored toilet program, and get that out there. And then the needle disposals. So those aren't really the issues anymore. We've done a lot. I was on this drug overdose project, and we got Narcan out everywhere. We started needle exchanges, but then in the SROs and all over the place. And now Narcan is really this overdose reversal drug. It's really widely used. It's really widely available. We started this needle pickup crew to pick up needles out there. You can text them pictures, but we have more overdoses now than ever before. It's really quite frustrating. So, yeah.
Is there like a specific population or like subpopulation that you would say is impacted by this crisis more than others?
The opioid crisis?
Opioid crisis and homelessness in general, mental health, like all of the above, I guess all the topics that we've discussed today.
Well, I mean, I think that there's like, you can kind of winnow it down, but yeah, I mean, the trans population, I feel like, is disproportionately vulnerable and at risk. And, the often pushed into the sex trade and vulnerable to drugs. And so, there's good organizations that are working on that issue. But I find it to be a hard issue. I think, like I said, I found like unsheltered women experience tremendous violence, and there's a lot of overlap with substance abuse and sort of cope. I mean, I don't know, chicken and egg kind of situation. But yeah, I mean, I think you can kind of add up these intersectionalities and you can just increases the vulnerability, right? So
yeah, and I know that there's I guess San Francisco is so it's so big, but it's also so small. And then like we've been thinking about if there's like particular neighborhoods that are at greater risk. Like we talk about the Tenderloin a lot, but is there like any other locations within the city where they're offering services, or maybe there's a lack of services where there should be?
Well, I mean, I don't know, like, okay, so with the, homelessness and street homelessness and substance use is often confined to sort of the east side of the city. So you have like kind of running from Bayview up through the Mission and, into the Tenderloin and, Western Addition a little bit. And so, uh, yeah, I mean, I don't know. There's a lot of services. There's a lot of people out there trying to make things happen. I think things do fall through the cracks a little bit more. Maybe in, I mean, there's people there. I mean, there's I don't know if you know the Harm Reduction Therapy Center. And they might, they have a mobile van and they do some work in some of the darkest places in the city, like Willow Alley or some of these other cutty spots. There's the needle exchanges are often locate themselves in those same sort of spaces. I've been working a lot this last 2 years on this area around Candlestick State Park. It's like Hunters Point Expressway in Gilman. And that's, pretty tough spot out there. So yeah, I mean, I don't know, you get into particulars and there's a lot of spots.
Yeah, it's a lot. It's so complex is what, that's what we're finding out.
Well, okay, so I live in Oakland as well. I find that Oakland is more sort of strapped. There's a little bit more sort of volunteerism and sort of self-advocacy within the communities, but there's less professional services and work being done. The problems around street homelessness and substance use is still present. It's a little less substance use heavy, and but some of these encampments also are pretty challenging. So I don't know. I would really say it's really, these political boundaries are sort of abstract to the people in crisis, and that there's a lot of good work that can be done here too. But either way.
So my school account is going to kick us off in like 8 minutes. So thank you so much for answering my questions, but I do want to just open it up if you had anything else to tell me that maybe I didn't ask a specific question that you might want to add some insight to.
Look, I don't know where you guys will want to kind of go with this, but the safe injection site and the drug user health is really a very exciting topic. We've seemed on the verge of doing something ever since Mayor Breed came into office. Her story and her sister died of an overdose, and she, she's very committed to these issues, and she had a committee on this issue. I took part in that, and we were all like 100%. We need to do this. We need to. And there was all this worry about the Trump. There's the time